With me on the line now is Capital Network's healthcare analyst Riccardo Lovi to talk through Avactaaudio. Riccardo, good morning.
Hi Andrew, good morning to you.
They've released immunogenicity data this week, Riccardo, of their Avactaaudio platform. How's it shaped up?
So, as a quick background for those unfamiliar with this technology, aptamers are engineered protein scaffolds developed by Avacta for therapeutic and diagnostic applications. And earlier this week, Avacta released the results of a study showing that aptamers have an immunogenicity profile comparable to widely used biotech drugs to treat cancer, autoimmune, and many other diseases. And fundamentally, these data support the further development of the aptamer platform for therapeutic purposes.
Just remind us, Riccardo, why immunogenicity data, why this is so important.
Immunogenicity refers to the reaction of the immune system against an external agent. So when the human body comes into contact with an external agent, including a drug, there is always the risk that this external compound will trigger an inflammatory response from the immune system. And for instance, this is the kind of reaction behind the use of vaccines. However, this is exactly the opposite of what we want to see with a drug, as a reaction from the immune system could neutralize the drug itself. And Avacta's immunogenicity study showed that aptamers only trigger an absolutely minimal immune response, in line with Avastin, the drug used as a benchmark in this experiment, and also in line with similar studies conducted in the past for big biotech drugs such as Humira, Remicade, and many others.
So that's encouraging. The big question here, I suppose, how do you reckon this will impact Avacta's valuation?
So immunogenicity data reported this week represent a very important de-risking step for aptamer's therapeutic platform. As such, we raise the probability of success we attribute to this project from 5 to 10%, and the value we attribute to the aptamer therapeutic platform moves up from 30 million to about 60 million. And Avacta's overall valuation, which also includes their diagnostic platform, then rises from 140 to about 170 million pounds.
A big week for them then. What do you reckon we should be looking out for from Avacta in the coming 12 to 18 months?
Absolutely. The next steps leading to an IND filing for aptamer's immuno-oncology program by late 2018 include further in vivo PK and toxicity studies and the preparation of the tech transfer and the CMC dossier. And we also expect Avacta to provide a comprehensive update of their aptamer therapeutic program around summer this year.
Very good, Riccardo. Thanks very much. Capital Network's healthcare analyst Riccardo Lovi there talking through Avactaaudio.